Minutes adopted. I move a motion to enter into an executive session to discuss confidential and privileged matters that may be related to threatened or potential litigation. Any second?
Yes.
All in
Second.
favor say yes.
Yes.
Opposed say no. So we go into executive session.
Good morning, Mike. Okay, how are you? No, 45.
Oh,
So
45.
stupid.
I could pay you.
So why don't you have to leave that building? After I was like, why don't we just go get one?
Yeah, that's
Now we will have a presentation of the fiscal year 2024 management letter. Mr. Guzman.
Sure. So I'm actually going to turn it over to KPMG, who will present their management letter to the audit committee. Maria Tiso is here.
Great, so good morning. My name is Maria Tiso. I'm the lead audit partner, and joining me today is Ryan Santanacita. He's the managing director on the account. If you recall, we came to the audit committee on October 22nd to present our required communications and the results of our June 30th, 2024 audit. And again, this was our first year audit. We did present one of the comment that's in this letter, which we considered a material weakness. It is the only management letter comment that's in this letter. There are various other comments that Grant had issued in their management letter last year, which were not in this letter because they've all been remediated. So there was no need to include those in here again. So with that, I'm going to turn it over to Ryan just to give a high-level summary. But it's the same comment that we addressed in that meeting, but we'll give an overview again on it.
Thanks, Maria, and good morning, everyone. As Maria had previously mentioned, we had identified a material weakness relating to the accounting for actuarial determined liabilities. There were two audit adjustments that were identified during the 2024 audit with respect to the pension liability as well as the OPEB liability, which resulted in approximately $324 million audit adjustment. The observation as a result of the audit adjustment was related to ensuring that review controls over the recognition of both the pension and post-retirement liabilities as well as their related deferred inflows and outflows were not properly designed to meet the intended precision level for actuarial changes in a given year. As noted, it resulted in approximately $324 million reduction to the deferred inflows, which increased or which reduced the net deficit from approximately $2.5 billion to $2.2 billion. As an opening balance sheet adjustment as of June 30, 2023. And our recommendation was for management to refine their review controls over the actuarial determined liabilities for both pension and OPEB, ensuring that there's continuous communication with the actuaries to ensure that matters are addressed timely, as well as communication with their auditors to ensure that the accounting treatment is appropriately accounted for. Other than, that's KPMG's recommendation. Management has provided their response.
Sure.
And other than that, if there are any other questions.
David, did you want to go over yours?
Well, yeah. So this is on behalf of H&H Management. So this is our response. So we currently have established processes to assess the information provided by the New York City Actuary's Office prior to the documentation of pension and OPEB liabilities. However, due to the fact that the fundamental actuarial processes and calculations are beyond New York City Health and Hospitals' control, there's a necessary reliance on that data. In fiscal year 2024, New York City Health and Hospitals management effectively identified discrepancies in the data that it received from New York City Actuary's Office, which were brought to the attention of the New York City Actuary's Office, prompting appropriate root cause analysis and subsequent corrections. Consequently, New York City Health and Hospitals management is optimistic that its processes can be enhanced moving forward by conducting annual meetings with the New York City Actuary's Office. These meetings will focus on reviewing the current year's actuarial calculations, thereby aiming for more timely identification and resolution of any potential calculation errors in the actuarially determined figures in the future should they occur.
Thanks. Questions? Or
Just a couple questions for KPMG. The findings and the audit adjustments were from prior year's activity, right? And so this year, we just heard from David that they had looked at it and
Correct, right. So it was an opening balance adjustment, so those two adjustments were relating to the prior years. For the current year, they were adjusted.
Okay, great. And partly due to, it sounds like, having
exactly.
found that, they had some
Right,
conversations.
exactly, right.
And so setting that process in place will prevent hopefully this.
Correct, right. So hopefully, when we come back for the audit, that finding will be remediated and would not be included in the letter anymore.
Terrific. And the findings, just so we don't have to go from material downgrade, we can go from material to gone.
Correct.
Right, yeah.
Right, exactly. As long as it's been remediated.
Yes,
Right,
right.
exactly. Yeah. Each
and-
finding stands on its own for each particular year.
Great. And the reason for it being material is just because of
The material amount of the balance.
amount.
Exactly. I mean, obviously, we would have still had a finding, but I guess if the amount was below our materiality, we may have been able to get to a significant deficiency, but we couldn't get there with the magnitude of both adjustments together.
Yes, individually,
And in
each
the
would have
aggregate,
been
right.
below what would have been our determined materiality, but they both went in the same direction, and when you aggregate them, that's what kind of raised it to the level of material weaknesses. They were going both in the same direction.
Right, terrific. And David and James, you guys have established now a process with the actuary, because obviously we have to rely on the data from the actuary. We're not going to do our own actuarial assessment, but just sort of paying attention to our pieces, and you'll have a conversation with them.
That's correct, every year.
Well, I think it's great news that all the other findings we've had have been remediated, so hopefully this will be the last one we see. Thank you.
Any other questions? Okay, thank you so much for your time and
Thank you.
thanks. So next we have an action item to consider for consideration. Ms. Patsos, please read the resolution for the record and proceed with the presentation.
Thank you. Good morning, everyone. The Office of Corporate Compliance is seeking a resolution authorizing the New York City Health and Hospitals Corporation, the system, to execute a contract with Coal Fire Systems, Inc. for HIPAA risk analysis services at a not-to-exceed amount of $7 million for a contract term of 3 years and two renewal options, 1-year renewal options, exercisable at the discretion of the system. Next slide. Okay. So HIPAA risk analysis is an enterprise-wide project that examines the privacy and security of our protected health information and electronic protected health information. The risk assessment analysis services are required by the Office for Civil Rights of the Department of Health and Human Services. The system currently lacks the sufficient resources to conduct such a enterprise-wide HIPAA risk analysis that meets the OCR's requirements. Coal Fire has been our incumbent vendor since 2019. Their contract expires on December 31st, 2024, and the current agreement has been for 3 years with a not-to-exceed of $4 million, the current spend of which is $3,971,003. A new RFP was issued to identify a well-qualified vendor to conduct this enterprise-wide risk analysis that meets the OCR's requirements. The minimum criteria set out in the RFP is that they must have performed risk analysis and security assessment services at a minimum of 2 different multi-facility healthcare systems. They have to be in good standing with High Trust or hold another equivalent certification. They must have been in business for at least 4 years and have to have a WMBE utilization plan, waiver, or certification. The evaluation committee consisted of the Office of Corporate Compliance, members of EITS, the Office of Legal Affairs, and the CEOs of South Brooklyn Health and Kings County. The criteria are broken down in terms of 40% for HIPAA security risk assessment experience, 30% for assessment methodology and reporting, 15% for cost, 10% for MWBE, and 5% for invoicing. The procurement process was on June 11th. The application to issue a request for proposals was approved by the Contract Review Committee. The RFP posted to the city record and sent to four vendors on June 28th. On July 8th, we had a pre-proposal conference to which 12 vendors attended. On July 25th, the proposals were due, and we received 3 proposals in response to the RFP. On September 13th, 2 vendors provided vendor presentations. And on September 24th, the evaluation committee submitted their scores, and the top scoring proposer was Coal Fire. And the vendor performance, as you can see, is they've met their metrics and have an overall evaluation quality rating of excellent. The vendor diversity team set a goal of 10% for this solicitation, broken down as 5% for infrastructure security penetration testing and 5% for vendor risk assessment. Coal Fire has requested a waiver due to all the software methodologies being used in the proposal are proprietary, and all labor and deliverables are self-performed. So we are requesting authorizing the New York City Health and Hospitals Corporation, the system, to execute a contract with Coal Fire Systems, Inc. for HIPAA risk analysis services at a not to exceed amount of $7 million for a contract term of 3 years and 2 renewal options exercisable at the discretion of the system. I'm happy to take any questions.
Thank you. Any questions?
Just on the required risk analysis, what do other systems do that self-perform?
Self-perform?
Yeah. It sounds like it's a requirement.
It is a
but
requirement.
We don't
have the resources to do it. It takes a full year for them to do the entire process, which includes reviewing all the acute care hospitals, the SNFs, the diagnostic treatment centers, the neighborhood health clinics, as well as an enterprise-wide focus on things that are policies and procedures and the data closets and everything that are system-wide. So, and they break it up into different tasks, so it's spread throughout the year, so it's kind of, we're not doing everything all at once at the end of the year. So, but it does take a full year to do it. And they have a team of approximately probably 6 or 7 people who work on it full-time.
full-time, yeah. And so it's not reasonable that we would ever have this
No,
capacity to
no.
do the whole, right?
Right, no, and,
analysis.
or the expertise as well, because they have consistently held the best expertise, in my opinion, in doing this type of project.
Okay. And I just had this is more out of curiosity. One of the criteria amounts was invoicing. What is that?
That is a supply chain and procurement, it's not something that I had, developed. It's something, I think it's something that on pretty much every procurement, I think.
Oh, it has now.
I think it
guess I didn't know
is
this
now.
before.
Yeah, because I hadn't put that in. So,
Right.
Yeah.
I see. Well, it's good because we want to make sure our invoicing.
Right.
So, just out of curiosity, the other proposers, were there any that met the goal, the MWBE goal?
One of them did, yes. They had one. They subcontracted part of their work. Coal Fire will be our 3rd contract with them, and they have been granted a waiver the other 2 times as well.
So it is that would be why the goal was set. It was possible, but 2 of the 3 were not able to.
Right.
Because they self-performed.
Yes.
Okay. Thank you.
Okay, let me ask for a vote. Dr. Katz?
Yes.
Frida Wang?
Yes.
Also Pagan, yes. So resolution approved. Thank you so much.
Thank you.
So now we will have an audit update from Mr. Akifi.
Okay. The first item that we'll have is the updates on external audits that are taking place. The first of which is City Comptroller's audit of the Department of Corrections and our providing of mental health services within there. This audit's been going on for about a year. The audit was stuck on, they needed to have a data sharing agreement, how they could look at a sample of prisoners without identifying them, and how we could provide information without the prisoners being able to be identified. And it's taken probably about 8 months to get that agreement in place, which they finally did agree upon how the audit could be done without identifying the patients or the prisoners. The next audit is language access. They're looking at our process for providing interpretive services throughout all our facilities. This audit's being done by the State Comptroller's Office. We should be coming to the end of this audit fairly soon. They've did a very extensive audit of our program, which we provide a large amount of interpretive services throughout the organization. The last audit that's going on now is the Be Heard program. We're a small part of this audit that's going on. More of it's involving the NYPD and the FDNY. Because they're actually where most of this program falls under. We're just providing services to them. That audit's going on now. Anybody has questions about the external audits? The next is just the number of audits that we have going on. We have a total of 5 audits in our plan for this year. 3 of them are in progress. 2 have not been started yet at this point and will be started. The last item we have is auxiliary audits. These are the audits that we have outsourced to the Bonadeo Group to provide audits of the auxiliaries. They're finishing up the last year. We did not extend this agreement, and we will not be paying with the audits going forward. But they are finishing up the last of them, and we do not have a set deadline in terms of when they will actually be completed. They are having some difficulty getting information from some of the auxiliaries in order to complete the audits. But they should be done, hopefully, rather soon. And that's all I have, unless anybody has any questions.
Any questions on audits? Okay, thank you so much. Let's move on then to compliance update. Catherine?
Yes, so let's review some of our activities since our last meeting. For the first one is the fiscal year 2026 risk assessment. As we had done last year, the Office of Corporate Compliance and Internal Audits are doing a combined risk assessment for 2026. I met with Joe O'Keefe, Chief Internal Audits, with senior leadership of the system to discuss their goals and objectives and any obstacles to achieving them or risks in their functional areas that they foresee. In addition, the compliance and privacy officers within the Office of Corporate Compliance and one of the auditors from Internal Audits have sent the risk assessment questions to the facility CEOs, CFOs, and HIM directors. And we will present, Internal Audits and Compliance will present the draft risk assessment to the Enterprise Risk and Compliance Committee in February. Next, we have the Policy and Resource Hub. I mentioned this previously. The Office of Corporate Compliance partnered with the EATS Data and Analytics team to develop a Policy and Resource Hub, which now houses all the system's operating procedures and will be, in the future, a location for all forms of resource documents such as policies, guidelines, tip sheets, and so forth. It is now live on the intranet, and the OCC and DNA team demonstrated the tool to all operating procedure owners, co-owners, and collaborators on October 23rd and 24th. On November 19th, I sent an email to all the owners, co-owners, and collaborators advising them of when their operating procedures are due for revision. And those reminders for the first set actually went out today. I know because I got one.
Are all the procedures on the same
Yes.
time?
And it's searchable, and once the procedures are updated, they will be searchable from within the documents. Right now, we have tags. They all have tags for potential search terms that would be used to try to find that particular.
But once it's all updated, you can actually just search and find it. That's great.
Yes.
And on the update schedule, is every procedure on the same update schedule?
Oh, no, it's the oldest ones are the first, unless there's a regulatory reason for updating it sooner, like, but the oldest ones are 20 to 30 years old, so those are up for revision first. Um, And the next thing is Corporate Compliance and Ethics Week, which was the first week of November. The next slide. Okay, thanks. The compliance and privacy officers hosted tables at each of their facilities to promote compliance and ethics, and allowed workforce members the opportunity to participate in games and win prizes for correct answers to certain questions. We also had 2 sets of webinars, one on fraud, waste, and abuse, and one on HIPAA. We had 4,156 attendees at the fraud, waste, and abuse, and 5,474 at the HIPAA webinars. We also gave workforce members an opportunity to enter into a drawing for a grand prize if they attended a webinar or completed a quiz with a score of 100 or the puzzles, and they also had to complete their compliance and HIPAA training in order to be entered into the drawing. And we also promoted our workforce member compliance survey that we do every year to hopefully increase the return rate on those questionnaires, those surveys, excuse me. The next thing has to do with the new proposed statewide common participation agreement that the state, through the New York eHealth Collaborative, NICE, which published the statewide common participation agreement on September 18th. And this agreement will replace all of the existing health information exchange agreements, such as HealthX, which is the HIE that the system participates with. It's also part of the state's initiative to update the infrastructure and operations of Shiny, which includes the Department of Health and recent amendments to the Shiny regulations. The agreements, the SCPA agreement has several changes from the HIE agreement. So, for example, participants such as the system won't have as much control over what information or how they share information, and it's not clear whether or not we will be required to share behavioral health information or substance use disorder with the state. NICE did provide for a 30-day comment period, and so the OCC, in collaboration with Legal Affairs and Regulatory Affairs, submitted comments on October 17th. NICE is still analyzing all the comments that it received and announced on November 22nd that it will not be releasing the SCPA on January 1st as it had intended. Any questions? Okay, and then we just have some metrics for the year. This is for through November 14th, which is what we had the data for when this was prepared. And we are lower in compliance reports than last year, which is good that we may not have as many violations, but we also want to encourage people to report. So there's an upside and downside to that. The next slide shows the privacy reports, which we are going down on steadily over the past 3 years. That is a good thing.
And there's a reason for that, probably, which is my chart. Right.
My chart
Because I
helps.
remember when you did a drill down that sending the wrong piece of paper to someone else was like one of the big
Yes.
ones.
Yes.
And
Unfortunately, that still occurs, but
right.
it's not.
Right, but now at least
it's-
most people can download their own data
Data.
from my chart.
Right,
So
they have to
we
visit
get
summary
fewer
and-
requests. So even if you made the same percentage of error, this would go down, right?
Exactly.
Because many
Yeah.
fewer people are asking, and
That's
that
correct.
should continue.
Right, yes, thank you. The next are the issue types. As you can see, privacy has consistently been the leader in the type of reports that we receive. And the next slide shows non-privacy cases by case volume by facility. And you can see that the Bellevue does have considerably more. It also is a bigger facility, so. And the next one is the same thing for privacy cases. And then we have the intake method. This is how we receive our reports. We do receive a lot of them by email and other office referrals, but the helpline does represent also a large share of how we receive our
It
reports.
seems like the hotline is increasing in sort of percentage of reports. Is that, did you get a new
That's,
hotline?
well, no, we didn't get a new one, but I would like to attribute that to better education and awareness of the helpline, yes. And finally, this shows our, the reporter anonymity, and it shows that we have, we are gaining a better, healthy reporting culture, and that most reporters are choosing to disclose their identities as opposed to being anonymous, which certainly helps the Office of Corporate Compliance investigate their reports, because it's much more difficult to investigate a report when we don't know who the reporter is and can't get further information from them.
So yes is they chose to be anonymous, right?
Yeah.
Okay, good.
Any questions?
Any questions?
Thank you.
Okay, thank you so much. Is there any old or new business to come before the committee? There being no further discussion, the meeting is adjourned. Thank you so much.
Thank you.
This meeting is no longer being recorded.